Hello everyone, how are you doing? This is Vincent Obita, and I want to congratulate everyone who has undertaken their Osce and have passed and are doing are now transferring their roles from either band 3 or 4 to band 5. Congratulations, all of you. Those who are practicing for their Osce, continue practicing, as that's what can allay the anxiety and also see you through the examination. Now, today we want to discuss something concerning implementation, particularly for the new test of competency, because it has a few changes in terms of the chart, how it looks like, and also in terms of the coding, okay, and also the order unto which the medications are placed. It's not very different from the old Osce, but it has some few changes that you need to be well conversant with. Now, I'll not measure so much on the order into which you undertake your implementation, but I'll take you onto some tricks that as a candidate you need to be aware of so that you don't fall for them and ensure that you pass your Osce within the first round. Now, allow me to go through an implementation chart that we tried to modify just to simulate what actually you can meet in your examination. And you might be provided with a scenario. You will be provided with a scenario. And in this case, I want to capture one of the most common scenarios whereby while you are doing your assessment and planning, you had a patient who was supposed to go to theater, okay, and they were nil by mouth by that time. That could be either ectopic pregnancy or hernia repair. Now, at the implementation, you have a patient who has undergone their surgery and now are back to ward. They are now permitted to take their medication oral. Now, in most cases, you will find that the due medication in that period either were coded, and the code for nil by mouth according to the new Osce is 8. Allow me to refer to the chart as well, is 8. So you will find maybe this medication was due at 8 a.m. and they were coded as the patient was nil by mouth. Now the patient is out of the procedure room and is now permitted to take their medication orally. Now administer medication to this patient. You will find that in most cases that's what now the Osce team is trying to target. Now you will find that they prescribe the start medications, and actually that's what you are supposed to administer, okay? Because the other medications which are on the regular meds were already coded in the morning, and maybe the time to the subsequent administration has already passed. So kindly follow with me. I wasn't able to load this. I'll upload the chart later on, but just follow with me. I hope we'll get along. Now, when you get into your station for the implementation or during your implementation, just like any other scenario, check scene for safety, is safe, introduce yourself, greet your patient, and confirm their ID, confirm their wristband against the paperwork you are having. After that, check their allergies and alert them that you are there to administer medication. For the scenario that I have is a patient who is back in the ward post hernia repair, and assume it's today at 14:00 hours. So all the medications you will be administering, you will assume it's today 14:00 hours. Never state any other time apart from the time you've been told to assume is your time of administration. Now, tell your patient that I'm here, I'm Vincent, and I want to, I'm opting to administer your 2 p.m. medication. Are you happy with that? That's fine. And if they have consented for you to go ahead, you tell them, I'll go prepare my medication, then I'll be back. Is that okay with you? In case you need anything, here's the call bell, just alert us. Then get back to your trolley. It's usually just next to you. Get back to your trolley. Before you touch the medication, do another hand hygiene, okay? Your trolley will be open and the cords will be there as well as the chart and a pen, some cups for receiver for your tablets, and also a cup for the patient's water. You will just assume it's there, but you will not actually use the water in that case. Now, at that moment, that's when now you read your chart, and you need to be very quick, because should you not be as quick as required, you will miss a lot of time. Gain, so that under 10 minutes you should be back to the patient's bedside to administer the actual medication. Now, when you go back to your drug chart, the first back to the drug cupboard, the first thing you need to do is go through the entire chart, okay, to check everything that you need to administer before you dispense your medication. You will be removing them but not dispensing them until you do you get to read through your chart. Now, you need to be very systematic while reading your chart, so that you don't concentrate on non-issues as well as read unnecessary information. Now, when you pick your drug chart, it's around 7 pages, okay? And the first page, the very first page, you need not to concentrate, because it only contains your candidate name, the scenario, and the time. You will only depict what is there. You need to listen to the assessor carefully, because the assessor will give you the scenario, okay? The scenario, you can read it silently, or you can, in this case, I have a scenario, it's just indicated post-hernia repair. Then below it is, assume it's today, and it is 1400 hours. Those are the only two things that you need to capture in your first page. You go to the second page, you will be saying, second page, I have a prescription here, and we will assume our patient is Will Smith for today. So I have a prescription here, that is page 2. I have a prescription here for Will Smith, date of birth 11/05/1945. Hospital number is 12345 depending on what is provided. And the height is 171, weight 70 kg, body mass index is 26.6. This patient in ward 3, date of admission is today, and time of admission is 7 a.m. The consultant is any doctor that is provided there. Now, these are identification for the patient. You in your own strategy, you can read only that for the first page, okay? Then now, subsequently, you will only be using 3 identifiers. That is the name of the patient, date of birth, and the hospital number or address, if you like. With that one, that's okay. Remember, everything there is placed there for a reason. For example, the weight is very key, especially when you are providing paracetamol and other weight dependent medication. Weight of 70, that's okay, so you will not be worried subsequently for what you are supposed to administer. Now, after that, for the new Osce, there's the part of all prescribers must complete this signature record. That is for the doctors. Then for the nursing team, there's nursing administering medication must sign and print their name here. As a nurse, that's where you will place your signature as well. So there's the part of date, write the date of your examination, name, write your 2 names, and your signature. you will be good to go. The next part is about alerts, and in this case here we capture all the allergies. In this case, my patient is allergic to penicillins, and the effects include the rash. That is very significant because subsequently when you will be giving medication and there is a penicillin, you need to code it because patient can react to it. Then the next bit is medication risk factors. None of them is there. You are not supposed to read all this, but you need to capture for the sake of drug administration. So you will just state in terms of medication risk factors, there is none, and you proceed. Next page, you will be identifying the patient in every page because another prescription can be placed there and it's not for the patient. So the next page, that is page 3, I have a prescription here for Will Smith, date of birth 11/5/1945, hospital number 12345 A, and maybe the address is this and this. Now this part contains the coding for either not administering medication. You won't read that one, but you need to know what they are. You won't read that. Then the next bit is once only medication. These are the start medication for the patient. So you will have, I have a prescription here. The first one is, the date is today. The medication is paracetamol 1 gram IV every 4 to 6 hours, and this was required at 1400 and is already administered by MJ. So this is a valid prescription, but I won't give it because already it has been given, and again it is IV medication. So in this case, that's a valid prescription. You are happy with it, but it's already administered. The next one, but take care of this paracetamol. So should you meet another paracetamol, the 4 to 6 hours should have elapsed. The next prescription is today, levothyroxine 100 milligram Powerol OD, and it is once only start medication. So you are happy, you will state, and the prescriber signature is there and pharmacy check is done. You are happy to give this medication. You will state, assessor, I'm happy to give this medication, I'll put it aside, and I have levothyroxine 100 milligram, expiry date is this, put it aside, don't dispense it yet. The next one is a prescription of today, Amlodipine 10 milligram Powerol OD. The prescriber is there and the blip number is there. Pharmacy check has been done by JM. These are due medication and I'm happy to give it. I have Amlodipine 10 milligram each, tablet Powerol. Expiry date is this one, I'll put it aside. So you have already 2 medications placed aside. Then you proceed to the next page. The next page is a prescription for Will Smith, date of birth 5/11/1945, hospital number 12345-6A, and the address you stated. Date of the admission is today, time of admission is 7 a.m. Now this prescription for antimicrobials, I have a prescription here for amoxicillin, prescribed today 500 milligram TDS Powerol to go for 5 days, and the time is 1400. And remember, that's the time your medications were due. So assessor, this is a valid prescription in terms of timing and the amount, but my patient is allergic to penicillin, so I will code it under, you can code it under 6 or 10. For 6 is an incorrect prescription because your patient is allergic to penicillin, or you can code it at 10, which is any other reason, and state. So you will go to the back of your prescription where all the all the codings are placed for drugs not administered and place there. Penicillin, time is today 1400, code it 10, yeah. And the reason for code omitting is the patient is allergic to penicillin. The action omitted, and you sign, okay? And you will inform both the patient and the doctor. You will verbalize that one to the assessor. Then you proceed. There is no any other prescription for antimicrobials. I go ahead to now the regular medicines. The next page, I have a prescription for Will Smith. Date of birth 5/11/1945. Hospital number 123456. And your address. Now, the first regular medicine is levothyroxine. A prescription of today, 10 milligram OD per oral to go for 5 days. This medication was due at 8 a.m. Yeah, and it has been coded 8 by SS. That's okay. So this is one of the medications that was there and has been coded 8. And if you check 8 is nil per oral. So nil by mouth. So this patient was nil by mouth in the morning. And already this is now afternoon. So you won't touch that bit because you will state that this patient was nil by oral by that time. And this medication is prescribed as start dosages. So you will only administer the start dose and then you will resume the normal timing tomorrow, same time. So you won't touch that. Move to the next one. So you won't indicate anything there because already it's coded. The next one is Amlodipine, 10 milligram, a prescription of today, OD per oral, prescription due at 8 a.m. 0800. This has also been coded 8 to mean the patient was nil per oral by 8 a.m. So you won't touch it. And move to the next one, though you will indicate to the patient, and that's why there's also amlodipine as your start dosage. The next prescription is about apixaban. A prescription of today, per oral, to go for 5 days, and this is due at 1600. So this one is, remember you are told to assume it's 1400, so you won't touch that one. So you will state that this is a valid prescription and a correct one. However, you won't administer it because it has not yet reached the time for administration. Move to your next page, and for the new Osce, the next page will capture things like the Prn medication. So you will have a prescription for Will Smith, date of birth 5/11/1945, hospital number 123456. As per required medications, you have paracetamol, a prescription of today, 1 gram, TDS per oral, to be given 4 to 6 hourly, and a maximum of 8 tablets in 24 hours. Assessor, this is a valid prescription, very correct, but my patient received an IV paracetamol at 1400. That is just before you gave your medication, and 6 hours or 4 hours has not elapsed. So this is a valid prescription, but you won't give it because 4 hours have not elapsed. However, you won't code this medication because it's a Prn medication. Okay, so you will just leave it at that. There is also the part of either oxygen. You will check if there's that bit, confirm with the assessor what are the you will just state, while doing my assessment, my patient had a saturation of 98% and there is no indication of oxygen shown on the prescription, and just proceed. Then the last bit, that's the last part of the at the back of your the back of your prescription chart, there is the part of IV medication. Check if there is any. So assessor, there is no IV medication. Otherwise, would there be any? I would check the rate, check validity, and also check the VIP score of the patient's cannula. Then with that time, you would have already coded only one medication, the penicillin one. When you are done with that one, now you will state, I'll now go ahead and dispense my medication, put the chart down, and do hand hygiene. Now go back to the 2 medications that you are going to administer. That's the start medication. Counter check. You will now read again. I'm going to administer levothyroxine 100 milligram per oral OD, and I have levothyroxine 100 milligram per oral, and now I have tablet. One tablet is 100 milligrams, so I'll only give 1 tablet. Dispense 1 tablet to 1 receiver. Then close your port as well, the drug holder. Then go to Amlodipine. You had already separated them from your drug couple, so it's easy to access them. Then proceed to Amlodipine, 10 milligram per oral. So I have Amlodipine here, 5 milligram per oral. So if I need 10 milligram, those will be 2 tablets. Dispense 2 tablets on your cup. Then now with all that, carry them with the little tray that will be there to the patient's bedside. Introduce yourself again. I'm Vincent Obita, one of the staff nurses, and I'm back to give you your medication. Are you comfortable with that? Are you able to swallow? Now, can I just confirm your full names and date of birth again? And your address? Can I confirm with your wristband? And are you allergic to any other medication? Yes, penicillin. Can I confirm with your wristband? Yeah. I can recognize that you have a red wristband for your penicillin allergy, and I won't give you any penicillin content. Now, I have a prescription here for you. I have a medication here. The first one is levothyroxine. This is a medication that is supposed to supplement your thyroid gland for your thyroid hormone, especially when it's not active. Okay. When you take this medication, you expect things like flashes and hot flashes or feeling sick and things of that kind. Should you get any of those symptoms, just let us know. Okay. Are you happy to take it? Here is the medication and here is the water. Have you swallowed? And assessor will respond yes. That's when you indicate there. And now, since it's a start medication, you state the time required 1400, time given 1400, and signature. You place your signature. Okay. Not the initial, the signature. Just give what the chart has requested. Now, you only document when the patient has taken. Okay. Then you will when the assessor states is swallowed, take back your medication. Take back the cup and the receiver as well. Now, the next medication is Amlodipine. It is meant to manage your blood pressure. When you take this medication, it can lower your blood pressure and you feel a bit of dizziness and tiredness. Yeah. Let any medical team know if you encounter things of that kind or you are feeling unwell. Okay. Are you happy to take the medication? Yes. You are required to have 10 milligram, and I have my pot here. You can even show the patient is 5 milligram each. So I'm going to give you 2 tablets. Here they are. Are you happy to take them? Yes. And provide the water as well. Ask them, have you swallowed? Yes. That's when again you document. Under time required 1400, time given 1400, your signature. You are done. And explain to the patient, are you in any pain? If they are in pain, they can't say they are in pain yet they have received the paracetamol. So just state that I can see you have just received paracetamol intravenously in just a few minutes ago. I'll just confirm you might give it some time to take action. Yeah, reassure your patient, or if they insist they're in pain still, tell them that I can see the paracetamol that was given you has not helped with their pain. I'll inform the doctor to consider changing either the painkiller you're having or to review you as well. Are you happy with that one? That's okay. Meanwhile, can I reposition you to assist you with your pain? That's fine. Okay. Then now also explain to them the medication that you've just omitted. Tell them that you are prescribed for amoxicillin, yeah, but I can see you are allergic to penicillin, so I won't give you that medication because you're allergic to it, though I'll inform the prescriber to reconsider another antibiotic for the same. Are you okay with that? That's okay. The other medication, these medications have only been given you as a start dosage. You can explain that to the patient if there's time. The other medication will be due at 1400, and that's Apixaban, and the other two medications are just the one I've given to you. It's only that you are not given at 8 because you are going for your operation and you are nil by that time. Any question? None. Okay, with that one I'm happy. Continue to rest. Here is the buzzer. In case you need anything, just let us know. If that's okay, that's fine. Do hand hygiene and take your tray back to the drug cupboard. Tell assessor, I'll keep all my medication, lock the drug cupboard, and do all the necessary documentation in relation to what I've just done. Thank you so much. With that one, you will be done with your implementation. The trick here is, what is changing with the Osce is that they are now shifting from the regular medication that you are supposed to administer and try to maneuver a bit of, they are trying to explore what the chart provides. So in this case, they have drawn you off the regular medication and want you to administer the start medication. Exactly, do that. Don't do a mistake of coding the paracetamol that was in the Prn medication. Don't do a mistake of giving the penicillin because the patient is allergic to it. Just code it. Don't touch the two medications that were due at 8 a.m. yet you've already administered them as start dosages. And also don't do a mistake of administering the Apixaban that will be due at 1600 yet you're administering 1400 medication. That's all about implementation. Continue practicing. Don't confuse yourself. Be quick in reading the chart, and with that one you will be good to go. Thank you so much. Continue subscribing to my channel, share the video, and for those who are sitting for their Osce in the upcoming days, I wish you the very best the very best while you are practicing, and be sure you will pass the Osce exam, and that will be a game changer as well. Bye for now, and let me see you next time. Bye.